Beyond the wars and economy, one of the major talking points in this year's American presidential elections was transgenders. In his latest statement, U.S. President-elect Donald Trump has said that there are only two genders and that he will sign executive orders to end child sexual mutilation, get transgenders out of the military and out of all American schools.
With the stroke of my pen on day one, we're going to stop the transgender lunacy. And I will sign executive orders to end child sexual mutilation, get transgender out of the military and out of our elementary schools and middle schools and high school. And we will keep men out of women's sports.
Now remember, this is not the first time that Trump has spoken on the transgender community. His entire presidential campaign was centered around him and Elon Musk slamming the community and what they call as woke ideology. American politics has been divided on transgender issues, with Democratic and Republican-controlled states going in opposite directions on LGBTQ+ policies such as medical treatment and what books on the topic are allowed in public or school libraries, or even children getting educated about various genders in classrooms. Now, before I get into a discussion on this, take a look at some of the numbers. Between 2010 and 2021, United States saw 8,403 sex change surgeries. Between 2016 and 2021, there was a 500% rise in these surgeries, with most patients between 19 and 30 years of age. 39% teens begin injecting hormones before the age of 18. And about 61% take it further and begin medical treatment at 18 years of age. Now, while Republicans have been vocal against transgenders, the Democrats have had the likes of former President Barack Obama honor lesbian talk show host and comedian Ellen DeGeneres with the Presidential Medal of Freedom, and he hailed her for the courage that was required for Ellen to come out on the most public of stages 20 years ago. So who's right in this entire debate, and what exactly is the situation in United States of America? Let's try and get a perspective on this. On Global Mirror, I'm joined by Sarah Spector. She is a political and legal pundit. I'm joined by Vibhuti Jha, former Republican candidate for New York Assembly. Anish Gawande, well, here in India, we know him as the national spokesperson for NCP Sharad Pawar faction, but he's also an LGBTQ+ activist, as well as Dr. Rachna Tataria, consultant plastic and cosmetic surgery from Fortis Hospital. Good evening and namaskar to all of you. Thank you very much for sparing the time to speak with us on Global Mirror. Sarah Spector, let me begin with you. What do you make of Donald Trump's statement? He has reiterated, it's not something new that he said, but he's reiterated the fact that there are only two genders, and that is male and female, and everything else is going to be banned once he's inaugurated as the president of US.
Yeah, well, I don't think he can just erase people's identity with a stroke of a pen. It's still going to exist. He may want to ignore it. I don't know how much authority he has either. I mean, the military, maybe they won't pay for transgender operations. Schools, I believe they're state controlled. I don't think he can just nationally say what each school district's going to do. I think his rhetoric is highly inflammatory. I think it's going to could cause a anti-gay movement where people might attack people physically for being gay or bully them in schools. It's going to encourage that. It's quite dangerous rhetoric, and I honestly, this did work for a percentage of the people in Middle America, because they used an extreme moment from Kamala Harris's 2016 primary run, where she wanted to pay for transgender operations in jail. And honestly, I just don't think that he's going to be able to maintain the momentum and the anti-gay momentum with the national population. I think we're more in the middle. There are things such as children's surgery and stuff that a lot of America doesn't agree with.
Okay, let me get in Vibhuti Jha on this. Vibhuti Jha, how do you ban identities? How do you stop somebody from identifying as something? How do you suppress people from feeling the way they do?
Thank you very much for having me, Shreya, and I wanted to congratulate you in person today on the show for being nominated and won the award for the best English medium broadcaster and news telecaster for Times
Thank
Square.
You, Mr.
So congratulations for that. Thank you for having me. I want to make it very clear, I'm not speaking on behalf of Mr. Trump nor the Republican Party, but I'm definitely going to express my thoughts as a Republican, as an individual as well. Look, long back when I was a student of psychology, I read a book, Abnormal Psychology by C.F. Strong. The first line of the book was that we all have certain abnormalities in us. That doesn't make us abnormal. Now let's approach the issue from different perspective now as a social entity. I think the Democratic Party, in my opinion, has done grave injustice to the LGBTQ community by aggravating the situation which existed normally earlier on. What I mean by that is, the Democratic Party has been always very divisive in their rhetoric. They pick on communities which are, lying dormant or have been in the society forever and make them as a political tool to play with. This is a reaction what Trump is doing here. The issue is not about LGBTQ. Look, people are born with certain kind of abnormalities all the time. People are deaf, not clear in their eyes. They are not able to speak well. They have Down syndrome. They have mental challenges. People are born transgender. I think it is part of a life the way it exists. So the question here is, why do we make issues which were not there earlier on? So allowing the transgender, let's focus on the transgender part. LGBT is not an issue here. Transgenderism, as practiced by Democratic Party, was taking away parental rights over the children on gender mutations, allowing people to change their gender who are not even qualified as an age restriction to smoke or drink or vote, but you are forcing the children to change their gender, and the country pays for the gender change. So it is not a fancy stuff that you go to the school and college and say, I want to change my gender because I feel like that. That is the problem. And the issue also is that allowing the transgender people who change their gender to participate in women's sports. As a sportsman, I'm horrified to see that. Allowing children, transgender people to enter women's locker room or the bathroom. My 60-year-old friend, she is a professor in New York, and she was horrified after her late night class that there was a man standing in her restroom and saying that I'm here because I feel like it. Now, this excess that is happening is very unfair to
so there are a lot of
LGBT
concerns, Mr. Jha.
Yes.
Yes, there are lots of concerns, and that was perhaps one of the reasons why this became a talking point in the American presidential elections this year. Anish Gawande, Vibhuti Jha makes an argument that this is an abnormality and that people have been forced to change their gender. People have been brainwashed into believing that they have a certain gender and therefore they should go through sex change surgeries.
I want to make one thing clear here.
Go ahead. Go ahead, Mr. Jha.
Okay. Anish, go ahead.
Born with a particular set of things. It is about the later stages when the normal people are being forced or persuaded, like California Governor Newsom did, made it an unnecessary issue. Your sexual preferences are your own. Go ahead. Lead your life as you want. But if you have a challenge, address that.
Let's get Anish's perspective on this, Mr. Jha.
Thank you.
Yeah. Anish, go ahead.
So firstly, Mr. Jha, with all due respect, I think it's been a while since you picked up that psychology book, because the science is very clear. We don't call transgender persons people with abnormalities, but under
Absolutely.
the DSM-5, it just categorizes the variation, right? And I think in many ways, we've come so far in acknowledging that sexual orientation and gender identity is part of the many differences we have. Some people have blue eyes, some people have brown eyes, some people are taller, some people are shorter, some people are attracted to men while being men, others think that they were born in the wrong body, right? And so to disqualify someone's lived experience as an abnormality is to be unkind. And I don't think this is a question of whether or not there is a big political fight going on or whether or not there is a bigger issue at stake. It's about, do we care about fundamental human values, right? You know, the Trevor Project, a leading LGBTQ plus NGO in the US, had a survey where 41% of young LGBTQ plus Americans had contemplated suicide, right? And in the midst of this, to say that we're going to erase your identities, we're going to create a public spectacle of your identities as President-elect Trump has today, is shameful. I think the reality is that if you're going to give a speech about what the priorities of the first day of your administration are going to be, and those priorities are transgender rights, then you've got your priorities all wrong. You're the head of the largest country in the world. You're the head of the world's biggest democracy, according to your own country. And this is what you want to focus on your first day in office. You know, I think we've come to a far better place in India. You know, over the last 10 years, we've had remarkable progress, bipartisan progress, let me remind you, under a BJP-led government, which I oppose very often on your very show, Shreya, and a prime minister who you know I have several disagreements with, but a government that still has a fundamental, basic human need of care, right? Where it's understood that the Transgender Persons Protection of Rights Act, passed in 2019 under this government, acknowledges that transgender persons deserve rights just like everybody else. Where the NALSA verdict given by the Supreme Court ensures that people have the right to their gender identity, and where the most recent sort of judgment by the government and the health ministry allows for gender affirmative care in hospitals under the Ayushman Bharat scheme. And I'm glad we have a doctor here, because I think she can also shed light on the fact that this is not something that's thought of overnight and allowed to happen the next day, like the Botox injection or a Brazilian butt lift, right? So I think to trivialize it is to negate the experiences of people. I just want to end on one thing to say that, you know, in India, we've had
Dr.
trans
Rachna, you want to come on
serving very proudly. You know, we have trans people serving very proudly. We've got transgender women who've been serving as police officers and have shown
let me get in Anish, Dr. Rachna into this.
Here.
Yes, Dr. Rachna, you want to come into this conversation and explain, you know, there are concerns and it deeply divides the society, not just in America, but across the world as to what really happens. There are concerns in America that children are injecting hormones, they are delaying their puberty, they're going for gender change surgeries. What do you see around you? What's the kind of, you know, thought that goes behind it? What is it that is that causes so much anxiety among parents, especially when a child says that, you know, they identify as something else?
So as I think Anish rightly said, it's gender dysphoria as per the new DSM guidelines, wherein, you know, there is a discrepancy between the gender that you're born with versus the gender that you identify with. And I completely agree, the number of surgeries have gone up across the world. So based on the Ministry of Health guidelines in India, there are clear-cut guidelines which are given, you know, on openly on the website, that there you know, every person who identifies as gender dysphoria is clearly evaluated at least by 2 mental health professionals in terms of a proper psychological evaluation, making sure they don't have any other underlying conditions like you know, psychosis, schizophrenia, to rule out any other some things which might raise a bias. And once it is you know, it's a fully documented gender dysphoria, only then we proceed ahead with further treatment, which could be a year of hormonal therapy once they're adults. And they are also asked to live in a society among their peers, friends, and families, living as the gender they identify with. Only if it is, you know, if they pass this test and they are in sync with their environment and they feel that, yes, they are happy, which matters in the end, they are then further on, you know, given a go-ahead to have any kind of corrective surgeries they wish to have. I mean, I'm sure that everybody knows about types of corrective surgeries, which which basically include breast, chest wall surgeries, genital surgeries, but also you could have facial feminization surgeries, hair transplants, laser hair removal, or even voice and speech therapies, which might be included.
Okay, Dr. Rachna, all of this is understandable. But Sarah, let me get in you on this point, that the argument there is the fact that, all right, as a male and a female or any other gender that you identify with, you can identify as something else. You don't feel comfortable in the body you were born with, you change that. But there are also concerns that there are a rising number of cases where human beings are identifying as, say, for example, non-living things in the United States of America. There are examples of that. There are examples where they're saying we identify as animals. There are able-bodied individuals who are saying we identify as, those who are not able-bodied, as physically handicapped, as differently abled, and they're harming themselves in the process to make themselves look like that. How do you then justify that?
If people are, I think you're saying they're faking it or harming themselves, that sounds more like a psychological condition. I don't know if they have some sort of Munchausen problem or they're trying to get attention, but I don't think that falls into the category of somebody who has gone through psychological evaluation, a year of therapy, as the doctor said, and has been fully diagnosed with being with gender dysphoria or just simply LGBTQ or just lesbian or homosexuality. I mean, these are not mental conditions, and these are identifying as an animal is, to me, I'm not a psychological expert. That's not normal, and I don't think that's what Donald Trump is saying. He's trying to gin up a lot of hatred. And what he's
But Sarah,
really
do you have that kind of caps? Do you have that kind of tests prevalent in the United States of America, where somebody goes and says, I identify as a non-living thing or an animal or a differently able person, and you have those psychological tests for them?
I'm sure that, I mean, there's all sorts of diagnoses where people are believe there's something that they're not. Schizophrenia with there's types of schizophrenia. There's types of multi-personality disorder. There's people who just go into have hallucinations. I don't think that you can say I'm a plant and have and people just ignore that. That's not something, at least where I live in Texas, that would be considered normal. I would think somebody would tell you to get a mental evaluation. Okay. Whereas if you say, I love a woman or I love a man, and you're a certain gender, it's accepted as normal. And again, it used to be treated as a DSM-5 diagnosis or DSM-4 in the old, but it's no longer a diagnosis. And to compare that to somebody who is having hallucinations just degrades the LGBTQ community.
Okay. Anish, do you not think that therefore there should be an age cap on when you can transition, just like we have it for voting and drinking? These are, of course, very complex issues, and, you can't draw a line where. But for the general guideline and for the general welfare of individuals, do you not think there should be an age cap? Because that is perhaps one of the biggest reasons why a lot of Americans today stand against and favor what Donald Trump is saying, because they see their children learning all about this in their classrooms and then at a very young age going for some sort of surgery.
You're asking me?
I'm asking Anish, Mr. Jha. Anish, can you hear me?
Yes, I can hear you.
Yeah. Anish, go ahead.
So, Shreya, the funny thing is that these are not very real concerns. These have been created concerns. The Trump campaign spent $20 million on anti-trans advertisements and to whip up this hatred. The sensible way of having this conversation has become impossible in the United States of America. You ask, do these tests exist in the United States? Of course they do. You know what doesn't exist in the United States of America? Healthcare. Affordable healthcare does not exist in the United States of America, which is why you have these concerns cropping up and you don't have a real solution to this. But Donald Trump does not want to answer that question. He does not want to do the harder job of ensuring that young people who are taking hormones less than they're taking fentanyl and doing cocaine are protected. He does not want to reform the healthcare system, but instead just wants to use these sort of clickbait tactics to get votes. Now, the unfortunate reality remains that there are multiple ways in which you address anybody who comes in with a case of gender dysphoria. It is only when it is actively injurious to their health that the decision to begin hormones or any other therapy will be taken before they're an adult. I mean, these are serious medical professionals taking charge of real medical decisions. And I think we do them a disservice by reducing them to people who do not know what they're doing and will put the lives of actual young people in danger.
Okay, we'll have to wait and watch how this really pans out. The last time around Donald Trump was there were LGBTQ plus healthcare protections that were rolled back. He'd also banned transgender individuals from the military. So we'll have to see. I have paucity of time, so I will not be able to take further this discussion. But both sides have concerns. Both sides need to understand each other. And let's, it doesn't help anybody in dissing the other side and saying, those are not real concerns or those are, they're abnormal. Both sides have very genuine concerns. So one of the most crucial things to do in this entire topic and discussion is the fact that we should have a sensible, logical conversation about it. Thank you very much to all my guests on the show, Sarah Spector, Vibhutija, Anish Gawande, and Dr. Rachna Tataria. Vibhutija, I really don't have time. I have to wrap it up here. But thank you very much to...
America has an Affordable Care Act in place. Facts and truths must not be distorted.
Okay,
America has an Affordable
Yet,
Care
Mr. Jha, it might be affordable healthcare, yet it takes months for a doctor's appointment. So we'll debate that on some other show on Global Mirror some other day. But right now, thank you very much to all of you for joining us on Global Mirror and sharing your perspective. With that, viewers, it's a wrap on Global Mirror. Thank you very much for joining us tonight. Bye-bye. Good night.